Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. This is our COVID-19 coronavirus community update for Wednesday, April the 1st. Today, as of 2 p.m., our total number of confirmed positives in Putnam County is 31, which is 7 more than yesterday. The other counties in the Upper Cumberland that have confirmed positives are Cannon with 3, Clay with 1, Cumberland with 14, DeKalb with 5, Fentress with 1, Macon with 4, Overton with 2, Smith with 3, Warren with 1, and White County has 2. Again, Putnam County has 31 confirmed cases, which is 7 more than yesterday. Please remember, we can only report the actual confirmed cases that have been verified by the state health department. We can probably expect our numbers to increase each day if we compare to what we are seeing in other parts of the country. Some experts are saying this could continue for several more days or even weeks. This is why it's essential that everyone follow the advice of the experts. There are a few of you that want to comment each day that the number we're reporting is not accurate because of a rumor you may have heard. Rumors are not verified results, so I'm asking you not to be commenting or posting with those. Again, we can only report what is the verified numbers from the State Department of Health. Remember, if you have symptoms of the virus and want to be assessed, you can call your personal physician or our Putnam County Health Department, which is doing drive-through assessment and testing weekdays from 9 a.m. to 3 p.m. The Health Department is located at 701 County Services Drive. The National Guard is on hand to help with the testing, and we are very appreciative for these fine men and women being here in Putnam County. Mayor Shelton.
Thanks, Mayor. This is in our community, and we must stop the spread. We must listen to the experts, especially the ones here in Cookeville, who care about us and are working on the front lines. 2 of those are here with us today. We've been advised to physical distance and keep 6 feet apart from others to lower our risk. We are all standing here because we care for you and our community. I implore you to listen, to follow the directives, take personal responsibility, heed the guidance from experts, and to do your part to help stop the spread. Use common sense so that you can protect one another. Now let's keep it real. The governor has issued a safer at home directive. Each of us should be staying home except for coming to work and going to the grocery store only as needed. First, safer at home and stay home, stay healthy, and shelter in place are basically the same things. They are just different words. But they mean don't go out, leave your house unless it's absolutely essential. We've read the shelter-in-place orders and their lists of essential businesses from some of the other states. Most of the states that have a shelter-in-place order have just as many, and in some cases, far more businesses open than Tennessee does. I'm thankful many of you are following the rules, having personal responsibility, and doing what you are supposed to do. There are, however, some people all over the U.S. and here in Tennessee and Putnam County that aren't following the guidance and staying home when possible. Some of you, unfortunately, have had your business temporarily closed, while some of you are blessed to be able to work from home. If you need to go out to get groceries, don't take your kids unless there's absolutely no other option. One person in the house go instead of the family. One person, one cart. Other options, delivery services, curbside pickup, and online shopping. To slow the spread during this uncertain time that we are all going through, it can't be treated like spring break or a vacation. When you go home, you need to wash your hands and wipe down anything you touched. It's about changing behaviors. Mayor?
Thank you, Mayor Shelton. The governor issued Executive Orders 21 and 22 on Monday. You can view all the governor's executive orders at the website sos.tn.gov. That's sos.tn.gov. Executive Order 21 closed some specific businesses like barbershops, hair and tanning salons, along with entertainment venues like nightclubs and bowling alleys. Executive Order 22 is the stay-at-home order and listed what are essential services. Now, I understand this list is very long and may be confusing. I suggest that you read the order for yourself, and if you have questions about your business, either contact the governor's office, your local attorney, or your insurance company for advice on whether your business is essential or not.
In the city, all public services continue, including police and fire protection and all utility services. City Hall and all other city buildings are closed to the public until further notice. That includes the Performing Arts Center, Parkview Skate Park, Cane Creek Rec Center, and the museums. Cane Creek Park and Dogwood Park, except part of the city playground, are open. However, use physical distancing. Be smart. With any questions about that, call 526-9591. If you're a senior or know a senior citizen, please check out cookevillecares.com, where you can register for a senior citizens welfare check option performed by our Cookeville Police Department. Now let's hear from Dr. Mark Pierce, infectious disease specialist at Cookeville Regional Medical Center, and CRMC CEO Paul Korth.
Thank you, Mayor Shelton. Thank you for allowing us to be here. Today I want to come and give an update at Cookeville Regional Medical Center. We currently have 4 positive COVID-19 patients in our facility at this time. Again, let me reassure you, all of those patients are in isolation. They've been in isolation since day 1 of their stay. Many of these that came in, we suspected on the front end before testing was done that they would be possibility of COVID-19 patients, and they have been in isolation. We have 2 medical center employees that have also tested positive, both of which are at home in self-quarantining themselves. Let me just reassure the community and everyone listening today that we at the medical center are prepared for this. We are doing everything we can to isolate these individuals. We're doing everything possible for our employees and our staff and our community as we continue to try to flatten this curve and stop the spread of COVID-19. A couple additional comments and statements I'd like to make today. We have been looking on a daily basis at alternative situations or alternative places that we may be having to take care of some of these COVID patients as they come in. So let me reassure you that the hospital and medical staff are well prepared and well advised on what to do in these situations. We've had several questions and several comments that I would like to address also today. Some of which has to do with our visitation policy. We've had many questions about children and what children that may contain this and have to be admitted to the facility. Our policy today is that if a child under 18 is hospitalized, that a parent or grandparent, one of which, could stay with that patient while at the medical center. Let me re-emphasize what Mayor Shelton and Mayor Porter said earlier about the stay at home. That is the way to stop this spread. The 2 places that you should be going to are work and the grocery. Anything else is more than we need to be out at this present time. Experts are telling us that the next 2 weeks could be very critical. So we need to really abide by this and take a look at what we're doing in our own homes over the next 2 weeks. We're very gracious today to have Dr. Mark Pierce with us. I'd like Dr. Mark Pierce to come up now and speak a few minutes. Dr. Pierce is our medical director of our infectious disease department and has been working with us and the medical staff basically since day 1 on this, and he has some comments to also share. So, Dr. Pierce?
Thank you, Paul. It's my distinct pleasure to be here, and I'm really impressed with the job that your 2 mayors are doing, trying to keep everybody informed, trying to keep a level head, and trying to give us all good guidance as we move forward through this. I would like to make a couple of points that I think we get a lot of questions about that are just very practical. One thing, I think it's important to remember that someone who is that presents with illness today, they became infected on the average a week ago. Someone who gets hospitalized today, they became infected on the average 2 weeks ago. So the numbers that we see now are people who were infected in the past 1 to 2 weeks or maybe a little bit longer than that. So even if we do everything that we're supposed to do starting today, we're still going to see an increased number of cases over the next couple of weeks. They're making projections that maybe our peak is going to be in about 3 weeks. And that may well be, but that's only going to peak and begin to go down if all of us take these recommendations very, very seriously. Another question that people get is, that we get frequently is, how long does it take you to become sick? We know that from epidemiologic studies that we've done, 4.5 days is what it takes for the average person, about 50% of cases. And by 8 to 9 days, essentially everybody who's going to become ill has become ill. And that's why we like for people who have been quarantined or who have been exposed to keep themselves isolated for at least 10 to 14 days, because the chance of becoming ill after that is very, very small. But again, I'd like for you to realize that if we do everything that we're supposed to right now and completely stop transmission, then for the next couple of weeks, we're going to see those people who are infected right now who aren't yet sick. Those people are going to be getting sick over the next week to 2 weeks. So we'll see those patients coming in. And then those patients, once they're ill, they'll be contagious for another week to 10 days. And so it's going to take an effort by all of us. They've extended it for another 30 days. I think it's going to require actually that for sure. And if we're not serious about it, again, most of the contagion occurs very early in the illness or even before a person becomes symptomatic. So you may not feel bad now, but if you're out playing with a lot of your friends and you come into contact with someone else who may not feel that badly but is actually already contagious, you take that home to your parent, you take that home to your grandparent, you pass that to a coworker. And so I think we all understand that, but sometimes it helps us to be reminded of it. So I would really plead with everyone to take very seriously the stay-at-home orders that are there. And again, at the hospital, we're very serious about it. If you're ill and need to come to the hospital, don't be afraid that you're going to catch COVID-19, because as Dr. Korth has mentioned, we're very serious about our infection control practices and keeping people safe. We do have 2 employees that have tested positive. Neither one of those, we believe, acquired their infection at the hospital. It was from outside contact. And so we have, again, 4 positive patients now. We have a number of other patients that are suspects but not yet positive. But these numbers are going to grow. Doesn't matter what anybody says, those numbers will grow. But we are prepared for it. And we would like as medical professionals to know that you're taking this seriously and that you're doing your part. And I seem to keep stressing that, but I think it's very, very important for all of us. And so thank you for the opportunity to come and speak with you all today. And I'm just really happy that our city and our county are serious enough about it.
Thank you, Dr. Pierce, and thank you, Paul. We appreciate what you and Dr. Pierce and the hospital employees are doing to prepare for this. As far as county office closures, we've been telling you as a precaution for our county employees, most county offices are closed to walk-ins, but you can call each office for an appointment. For more details on the county facilities, go to our website at putnamcountytn.gov, and on the main site you'll see a link to click that you can check out all of our facilities and what the details are on each one. Mayor Shelton and I have been talking to you about the COVID-19 virus for the past 13 days. Our advice continues to be for all of our citizens to act like everyone you come in contact with may have the virus. That way you're doing everything you can to protect yourself and your family. To get past this terrible disease, we all have to take this serious and do everything we can to fight it. I get asked the same question all the time. Randy, when are our numbers going to peak? Well, like Dr. Pierce said, we can't answer that. I'm hopeful it'll be in the next week or 2 or 3, but that is all going to depend on how we work together to stop spreading it. Are our numbers going to continue to go up? I think yes. As we continue to do more and more testing, the number is going to rise, so you have to be prepared for that. There may be days like yesterday where it doesn't go up at all, but then there may be other days when it goes up dramatically. As we have continued to say each day, we don't want you to panic, but we want you to take this serious. We live in an awesome community where we care for one another. Remember how we acted during the tornado when everyone turned out in thousands to help those folks. We have to have that same caring attitude that we had during the tornado for all of our fellow citizens now. We are Putnam County strong, and we will get through this, but we all have to work together to make it happen. Mayor.
Again, everyone must do their part to stop the spread. Now is the time to help by taking this serious and being part of the solution. Shannon and I had a friend, Noelle Smith, send us this the other night, and I want to share it. She wrote, "I honestly think it's ridiculous that we have to have a governor or mayor or the president to tell us and enforce us to stay home. Why can't people just do the right thing? Why do we have to be treated like kids that don't listen? I seriously feel like I'm in elementary school again. Some people doing as told, some people pushing boundaries trying to see what they can get away with, some people just refusing to listen to any authority figure because no one can tell them what to do, some people watching the ones misbehaving, some people tattling because so-and-so isn't doing what the person in charge said to do, some people sitting at the front of the class bragging because they are following the rules exactly as stated, and some begging everyone to please follow the rules because the consequences will be bad for everyone if not everyone follows the rules. Yep, we're in third grade again, just on a bigger scale. So listen, this is a serious virus. Please take it serious. It's spreading, and people, even young people, are dying. No one is immune, but so many think they are invincible and that it won't infect them. It affects all ages. We must be diligent to physical distance. We know it makes a difference to protect the health and safety of your family and everyone else. Don't panic. Be supportive of one another. Wash your hands. Imagine that every place and every person are crawling with a COVID-19 germ and act accordingly. Stay at home and away from people as much as possible. Make reasonable, educated, common sense decisions. The sooner everyone follows directions, stays at home, and acts responsibly, the sooner all of this will be over. Remember, don't believe everything you see and hear, and don't spread rumors without fact-checking it first. For the most up-to-date COVID-19 information, links, and resources, you can visit bettercookeville.com. We will get through this. Continue to pray for our country, our healthcare workers, and our responders. Let's choose faith over fear and be smart. God bless.
Thank you, Mayor. Mayor Shelton and I, we continue to do these updates to keep you informed. We took an oath when we came into office and a promise to the citizens of Cookeville and Putnam County that we were going to be as transparent as possible with you. You may not like what we have to say, but you can rest assured it's the facts and the truth. We will continue to do these updates. Our next update will be Friday at 4 p.m. unless something dramatic comes up that we need to update you sooner. Please continue to keep us as your community leaders in your prayers along with our state and our country. We're working hard to keep you safe and to get you informed and keep you informed of all the information that we have about this terrible disease. We keep saying some of the same things over and over, but we still keep having the same questions, Mayor, over and over. So that's the reason we keep repeating some of it. Please take this serious, act responsibly, and be a good citizen in Putnam County. May God bless you and your family.
Thank you.